No, I have not started it. I'm waiting for Madam to make the introductions.
Joshi sir, are you there?
Yes, madam.
Okay. Who has muted me? Good evening, friends. Today we are gathering here to listen from Ramachandran Srinivasan sir about the neuropathy treatment. This is the Lajpat Rai Mehras's neuropathy treatment, which will give more protocol to help us to get relief from all the problems from its root itself. It will help to release all the root causes of the diseases which we suffering for a long time. It will help to correct the blood circulation. It will help to correct the lymph and nervous functions and the balance between the acidic and alkalinity of our body fluid. The removal of gas itself will give more relief for your pain and aches in your body. So many things are there. And we all know that he's a very good spiritual person. And from today onwards, we can expect more sessions from him. With all your permission, with all our wholehearted support, I am inviting Sri Ramachandran Srinivasan sir to Joshi's Kerala Group platform. Good evening, sir. Welcome, sir. We all are awaiting to hear from you, sir. Thank you, and thank you so much for your kind presence. Thank you, sir.
A warm smile welcome to all of you. At the very outset, I thank Joshi's Kerala Group, Lalita Madam, and Shivkumar sir, and the entire team, which has been hosting so many exotic educative sessions of great use to all of us, patients as well as therapists. Today, I have the pleasure to introduce once again a very unique system of pressure-based therapy, which is almost a complete system by itself. The name of this system is called Lajpat Rai Mehras's neurotherapy system. Now, the moment you hear a name, all of us, what is the habit we have? We will go to Google and search the word neurotherapy. So if you Google the word neurotherapy today, you will find that it refers to a computer-based system which originated in Germany and in the United States. And it's a very powerful technique. And in fact, it has got a lot of followers in many countries of the world, and especially Australia, etc. But the system which I am going to talk about is totally different. That is called biofeedback neurotherapy, the other system, computer-based system. But this system is a unique medicine-less therapy. It treats and heals the body of almost every possible ailment. So it is basically a pressure-based therapy system where we apply pressure at specific locations for a specific time and in specific sequences. So these three things are important: specific locations, specific time, and in specific sequences. And by this, as Lalita Madam was kind enough to point out, what do? We correct the flow of blood, lymph, and nervous channels in a specific manner. There are certain treatment protocols for it, which have to be followed, certain rules and regulations. Though it is a pressure-based system, yet it is totally different from any other system of therapy which is known in modern times. And that includes any form of pressure therapy. This is totally different from that. So then the question will arise, what exactly is neurotherapy? So it is a special treatment protocol. It is called Lajpat Rai Mehras's neurotherapy. And this helps people feel better by focusing on the root cause of diseases. That means it does not work only on symptoms, it works on systems. So basically it works in the following areas. Number one, It helps us to find and fix the root problems that can make us feel unwell. So we are going, what makes us unwell, we find that root cause, and then we set it right. Then it corrects. How do we do it? It corrects the circulation of blood, lymph, and nervous impulses in the body. And the basic theory is that there should be a balance between acidic nature and alkalinity of the body fluids. And this is what neurotherapy mainly harps upon. Acid-alkali balance, we call it. And of course, the removal of gas, which, as all of us know, is one of the main causes for body aches and pains. So what do we do? How do we work it? We use gentle techniques to check how the circulation of blood and lymph to the viscera. Viscera means internal organs within the abdomen. So whatever is below in the abdominal cavity, that is called viscera. So we check how the circulation of blood and lymph is affected. So for this, we have our own set of diagnostic pain points, but we also integrate the findings of modern techniques such as blood tests, X-ray reports, USG, CT scan, MRI, etc. So we integrate all this information, and then we come up with a treatment protocol. So by doing all this, we can find out if there are blockages or imbalances in the various body systems. So once we identify these issues, we use specific methods to restore balance. So where all will be helpful? Of course, there are many big lists are there, but it will be helpful for a wide variety of conditions, including digestive disorders, chronic pains, anxiety conditions, female disorders, sleep problems, and fatigue. These are some of the major headings. So then, why should anybody choose to learn neurotherapy? There are three main reasons, though many more will be told later on. First thing is, it has a holistic approach. We look at the body as a whole person, not just the symptoms. And then each person receives a customized treatment plan tailored to their unique needs. That means it is not like the same tablet being given on all days for a number of days. I mean, it is not that. A customized tailored treatment plan means it may be changing from day to day, from person to person, etc. And it is most important, it is safe and non-invasive, because we don't use any medicines also. There are no surgical procedures or anything involved. So it is safe and non-invasive, and it is safe for all ages, from a one-day-old baby to a septuagenarian, centenarian. Anybody can take this treatment and they will get benefit. So today, it is my pleasure to teach certain fundamental points about our body and how we are going to apply the knowledge gained from fundamental physiology, how we can apply that knowledge to help ourselves. When it was started, this therapy was a one-to-one therapy. That is, a therapist was needed to treat a patient, but by divine grace, I will say, for the past several years, especially after the advent of the COVID-19 Holocaust, I have been able to develop very efficient protocols where we can even treat ourselves. In today's class, I will be teaching you a few points to treat certain common ailments, and shall also be touching upon the utility of these points and how they are going to help our body heal itself. I won't be speaking too much about physiology because I have separate classes for that, but I will give you a fundamental knowledge, because that will help you to reinforce whatever action you are doing. So once you know a logic of a particular thing, then you will be convinced to use it in your life. The first thing is, almost every ailment within the body, whether it is back pain or knee pain or neck problem, a headache, or constipation, loose motions, all these are just symptoms and they keep on changing. Since majority of you are already practicing alternative healing modalities, you all know that we have only a limited number of organs in our body, a handful of organs, in fact, even though the number of ailments seem to be thousands or 10,000. But those 10,000 different ailments or symptoms are made by what is known as, we call it permutation and combination of only how many organs? A handful of organs. By permutation and combination, I mean mixing. So almost every ailment within the body, it is due to the permutation and combination of these handful of glands. So these handful of glands, when they are not working properly, they produce certain symptoms. And these symptoms are being treated by several systems of medicine and therapies. So they are all quite successful. But treating the symptoms alone is not our way in neurotherapy. Treating the symptoms alone is not our way in neurotherapy. So what do? In neurotherapy, we treat the systems, not only the symptoms. The symptoms automatically go off by themselves. So this is the basic, fundamental logic of this therapy. Of course, we have got a lot of theory for people who are interested in our separate classes. But here, we are going to teach you less theory and more practical. We are going to teach you how we are going to apply our therapy, that is neurotherapy, Lajpat Rai Mehra's neurotherapy, how we are going to apply our therapy to our day-to-day needs. So I will be concentrating mainly on teaching you certain protocols, which will carry you through for 1 week. And next week, by God's grace, I will come back and ask you for the feedback. And you will, of course, you have to give this feedback in Joshi's Kerala group and in whatever group you are come across this message, so that all can benefit. Everybody should benefit that this therapy is working wonders, is working wonderfully well. So now we come to a question. The fundamental system in the body, which is responsible for all activities. You will have a number of answers. You will say the heart, the brain, etc. No. From where we get energy for doing our jobs, then you will all know, yes, it is the digestive system. The digestive system is the fundamental system in the body, which is responsible for the energy we get for doing our jobs. And so, in neurotherapy, we say that first correction is for the digestive system. The digestive system has to be corrected first before treating any other system. And of course, all of you know, we have 11 systems in the body, but all the other 10 systems, each and every one of the 10 systems, other 10 systems, they depend on their energy on only one system, and that is the digestive system. So that is why the digestive system correction is most essential and most important. So then how is this correction to be applied? First, we'll see what things are lacking in that system. Basically, all systems will work if they get proper nutrition. And by proper nutrition, I mean the food must be properly digested. And only then the system, each and every organ and gland will get nutrients, and those nutrients will then start functioning within the body. And this is where Mr. Mehra, whom we call as Guruji, I normally refer to him as Guruji, But for newcomers, this Mr. Lajpat Rai Mehra, he came up with a wonderful observation. And this observation is over a span of not a few years, almost 75 years. So he observed during his 75-year sojourn with neurotherapy. By the way, he is no more now with us. He left for his heavenly abode in the year 2018, October 2018, exactly today. Exactly today, October 18th, 2018, he left this body for his heavenly abode. Okay. So he observed that during a span of almost 75 years, that whenever a body or an organ does not receive proper blood supply, which means it will not receive proper nutrition. And this invariably exhibits itself as pain in a few points around the navel. The pain may be in an organ or in some other location in the body. So now, when I tell this to some people, somebody asks me, sir, how do you know it is because of the pain? Only the pain is means the organ is not receiving proper blood supply. How is it so? And I said, okay, very simple. All of you can try it if you want. Just take a rubber band, rubber band. Just take a rubber band and put it over here. Now, before that, I asked, do you have any pain in your finger? Then he says, no, sir, I have no pain in my finger. Okay, no problem. You just take a rubber band and fix it tightly over here, let us say, halfway through. Okay. And then you keep talking to me. Now you ask me whatever questions you want, and I shall answer. Within a few minutes, even less than 30 seconds sometimes, he will say, sir, this place is paining, sir. This place is paining. Here there is no pain. So here there is no pain, but this place is paining. I said, did you have any pain before? No, sir, I had no pain, sir. No problem. No, you said here there is pain, here there is no pain. Now I will set it right. No, very quickly. You just remove that rubber band. Remove that rubber band. So what happened? Within a few seconds or about 15 seconds or so, he says, sir, my pain is gone. So what did I do? Did I give you any medicine? Did I give you any treatment?
8 o'clock paracetamol.
Somebody is talking. I'll be happy if you mute others. Sorry. I'm sorry. Please do not talk. Please mute yourself when you talk. Okay. Thank you. Sorry for this.
సో పారాసిటమాల్ వేసుకోవాలమ్మా ఇవాళ రేపు కూడా వేసుకుంటేనే ఒకసారి టెంపరేచర్ చూస్తాను లేమ్మా లే.
Okay, I'll mute you. I'll mute Lakshmi Madam also. Okay, fine. So, the moment the rubber band is removed, the pain over here goes away. We have not done anything. We have not given any treatment. We have not given any medicines. This is just a simple example. Everything is not so easy. But it gives you a principle which Dr. Mehra has been using. And he has used it to with wonderful effect. So, Dr. Mehra says he found out that whenever a person has any problem, it can be digestive disorder, can be back pain, it can be knee pain, it can be anything. He had found that certain points around the navel, they exhibit pain. And this is different, or this is not concerned with whatever other organ pain the person is having. It can be knee pain, back pain, as I said, headache, etc. And it is also seen that this pain point around the navel, that is more or less the same for all people or most people with that particular symptom. Maybe not all, but most people with a particular symptom. I will show you some very classic examples. I will discuss. Then that is one thing. That means certain pain points around the navel they exhibit pain. And whatever that, however many people have that particular symptom, they will have pain in those pain points. The pain points around the navel. We'll show you a chart for that. So again, he found that it is not necessary that all people with knee pain will have pain in the same points around the navel. And that is where different constitutions, see, it depends from person to person. If a person's constitution is good, he may not feel pain point so much. He may not have the same pain points which another person with poor constitution or weak constitution is having. So this is where different constitutions, they play a role. So here I will request Joshi sir to show us the first chart, the chart of front of the body pain points. Yes. Yes, that's it. The first one, yes. Now, this is there in the group also. That's it. So now you can see here. So here you can see. Yeah, that's enough. Yeah, that's enough. Okay. Now here, this is an approximate location. The thymus gland is over here behind the sternum. This is the sternum. And this point we all know is the solar plexus. This is where, especially people with diabetes, they will have pain over here. They will have pain. This is called the pancreas pain point. Okay. So this is over here. And then here you can see 1, 2, 3, 1, 2, 3, like that. Here also 1, 2, 3. So what do these? And here you can see 1, 2, 3. That means the 1 is always on the outside and 3 is nearest to the center. Now these points are our treatment points. Okay. So here you can see the name gall. This is the gallbladder. But remember, this is not that the gallbladder exists over here. The gallbladder is inside. But whenever there is an improper blood supply to the gallbladder, then the pain will be felt in one of these 3 points, and more so in the middle point. Similarly, whenever there is problem in blood circulation to the spleen, then you will see the pain will be more manifested over here, the second point. But of course, it can go here or it can go here also, depending on the constitution. And this is called the solar plexus pancreas. And you will see here you see gas 1, 2, 3. So this gas 1, 2, 3, I will explain that between the pancreas pain point and the navel, this is the navel, between this, thank you. So between the pancreas pain point and the navel, if you mentally divide this into 3 parts, then 2/3 part from here to here, let us say, 2/3 part, you will feel the pain of the gas in the stomach. And how does gas in the stomach exhibit itself? By something which we know as belching. So whenever there is belching, a person, if they touch anywhere between here and here, 2/3, this is 2/3, this is 1/3, let us say. So if a person touches over here, between here and here, you can all touch and see in your own body. So when you touch there and see, you will see that there is either lot of pain or there is hardness, or you just feel uncomfortable. You just don't want anybody to touch over there. You also cannot touch over there.
So can't see the arrow.
Yes.
Now I can.
Is it seen? Okay.
Place again, sir, please. For
Yeah,
the
I will
gas.
definitely. No, I'm going to explain this 2, 3 more times. I am going to explain because this is the most important. This is the fundamental. how we are able to diagnose quickly. So this is the pancreas point, which we know as the solar plexus. The solar plexus is here, and then this point is just below the sternum bone. You have seen this is the sternum bone. This is the end of the tip of the bone, just the fleshy part after the bone. We are not doing anything. We are not touching on the bone to find anything. You cannot see anything on the bone. But the fleshy part after the bone, just below the bone, this is called the pancreas pain point. And why we say pancreas pain point is because most diseases where pancreas is involved, and the most important we all know is diabetes. So there, then those people have lot of pain just over here, just below the sternum. Yes, just over there. And this is a fleshy part. Okay. Then after the fleshy part, mentally I say you just divide this area into 3 parts. So approximately you will say from here to here is 2 parts, and from here to here is 1 part. Okay. So now when you touch, suppose you are having a problem of belching. Suppose you are having a problem of gas from the mouth or anywhere you can have. There are many other cases also. In that case, you will see that this area, by touching itself, you will not feel comfortable, or you will feel pain over there, or you will feel hardness over there. It can be anything, because everybody's constitution is not the same. So different people may exhibit different in slight some of these symptoms. Some people may find it very hard. Some people may find it painful. Some people may find it that the moment they touch, they give like that. They will give big belching sound. Yeah, that happens to some people. You just have to touch that. They have to touch their that area, and then they will give a big, loud belch. So that is called the belching due to gaseousness. And as Lalita madam said, gas removal is a very, very, very fundamental necessity. And that's what we are going to teach you in today's class. It is going to be a practical class. So I am going to show you how simply you can remove the gas from the body, and then you will continue it, practicing it. All those things I will tell you later. Okay, now we come to this place called gall. The gallbladder pain, if there is, let us say, cholecystitis or any gallstone problem or inflammation in the gallbladder, all these things, they come now. Nowadays, it's very common. So in that case, most people will have pain over here. And some people may have pain over here, or in all 3 places also, depending on the constitution of the person. So this gallbladder pain, that is why it's written gall. And remember, this is the right side of the body, this is the left side of the body. Okay. So right side and left side, you can see. Now, who has been drawing over here? Some children have been coming here, I think. Let me see how to remove the drawing first. Somebody, thank you. Somebody has removed it. Please don't draw over here. And here somebody has drawn. If you can remove it, I'll be very happy. Okay. Then this is the point of gallbladder pain. Then you come to the opposite side, that is spleen pain. So the spleen pain may be for cases where some RBC destruction is going on, etc. But otherwise, spleen pain may be whenever there is a problem in the descending colon, then also you may have spleen pain. Okay. Then for people who are having dysentery, usually the pain will be felt. See, you see a diagonal line from here to here. So usually the pain will be felt over here. It won't be felt in the ribs, but for some people it may be felt here, but many people it is felt at a 45-degree angle in this line, and middle of that approximately. And the reverse of it is constipation. I will teach you how, in our further classes, I will teach you how all these points can be treated by simple techniques. Okay. Then here, as I said, gas, you have already seen gas. The pain of gas will be 1/3 for the stomach gas and I mean, 2/3 for stomach gas and 1/3 for intestinal gas. And intestinal gas normally comes out as what? It comes out as what is known as flatus. Flatus means gas from below. So that people who are having that problem of flatus, they will see this place is giving a lot of pain, or it is very tender. You can't touch the area, etc. Or it may be very, very hard over there. So all these things can be there for people who are having intestinal gas.
Sir, we cannot see the pointer and it's difficult to understand.
Okay. And
Yes,
now
sir.
can
I'll just suggest you that make that arrows in different colors, so
Yes,
we can
yes, sir.
understand.
Yes, sir.
yeah,
Yes.
wait. Yeah. Let me see.
It's just beginning only, just an introduction. Sir will show you everything in detail in his own body. Don't worry about it.
I know that.
It's only an
Anyway,
introduction. To explain
what
you
they
about
say,
this.
let me see if I
Yes,
can
please,
at
sir.
least show the arrow. I don't know how to make the arrow in different color. How do I do it? Can anybody
sir.
guide me on this? How do
No,
I
sir,
do that?
no, you can do it, sir. You have to operate from your own computer.
No, I know, but I have not done that. Changing the arrow color. Wait a minute. No captions, no. Record room, reaction. Used to be there, I remember, but now I'm not able to locate it. Okay. Acha, madam. Now, Savitri, madam, please remove your whatever you have made over there. Now, how do I stop all these things? Please remove Savitri, madam's that arrow and all, red arrow and all you have done. If you know how I can change my color, you can let me know. It used to come here.
Sir,
palette
you
was-
go to that edit thing, sir.
Ah,
That pen thing is there, no? That symbol of pen, sir.
wait a minute. 1 minute. Where will I find it?
Near where your screen, that mute and start video and participants are there, no? Next to that mute, it is coming in the laptop, sir.
Oh, chat and share screen.
No, sir. Yeah, the last one, sir. After the chat and share screen participants. After that, sir.
Showing only captions, caption setting.
Sir,
So
I
it
don't
will
know
be
how.
near left side.
Left.
Yeah, sir, near left side, sir.
Yeah, in my left side, I am reading. In my left side, first one is security, then participants, then chat, then share screen.
Sir, you click on that, sir, you'll get an edit thing. You click that bar of those participants and all that bar, you just put a finger,
Oh,
sir.
okay.
There you'll get a.
Wait, I'm seeing. I'll see if I can. Somebody has decorated with so many red lines. Now, this really, I wish people don't do that. See, some children are there. I don't understand. See, now somebody is, yeah. Okay, thank you. Somebody is erasing it. Excellent. Great. Now, Acha, I am now having a simple point. Please remove that. Yeah. Now I am having a simple pointer. Can you see this now? See, I am not getting that color. I remember it used to be there, but I am now not able to get it. I don't know why.
Yes, sir. Yes, sir. Yes,
Yeah.
sir. We can see.
Yeah, that's it. So now, if nobody else disturbs, then probably you will not require anything. And I will, for next class, I will check up where it is. But it won't be needed, don't worry. Now, what I mean to say is that we are, again, who is this lady? Yeah, thank you. Yeah, somebody, if anybody knows how to erase this, you please erase. I will make somebody else also as co-host if necessary. If somebody can offer, you can erase or whatever. Okay, now I repeat, sorry for the interruption. The point between this is the pancreas pain point, solar plexus, and between that and the navel, this point we divide it into 3 parts mentally, not physically, of course. So mentally, then 2/3 of it is the problem due to gas. So whenever we have pain over here, suppose I have any technique by which I can remove this pain or this hardness, then you will see that the pain over here will go away. And not only that this pain is going away, this pain, whatever it is else it is causing in the body, so many problems it is causing. Gas, is a great problem crosser, right from blood pressure to anything you want. Gas will create that headache, whatever. So those points, those problems also are mitigated. They are reduced. So that's the beauty of it. So it is not just removal of the pain over here. It is going deeper than that. Because of that improper blood supply, what we are doing is we are going to increase the blood supply over here. And how that is to be done, I will let you know. So then by doing that, what you are getting is that whatever symptoms have occurred as a result, all those are also getting corrected. So that's the main thing. And for dysentery, I said that it is approximately halfway. If you draw a mental line between here and here, halfway through approximately, this is the area. This is far away from the rib, but this is the area where people with dysentery will have the pain. And
we can't see your cursor.
This one, this number 2. You see, you can see, right? See the DYS dysentery. You can see that?
Yes, sir.
Yeah,
Yes, sir.
DYS dysentery. A straight line from there, wherever it is going. Yeah, somebody has been kind enough to. Yes, thank you, sir. Thank you. So that blue point, approximately. And who has made this red drawing? Please remove it. This blue point, this one is approximately the dysentery point. Okay.
Sir, for belching, which one you said, sir? For belching.
Yeah, for belching, pain will be between this and this. Between this and this. 1 and 2, let us say. From the solar plexus up to here, some approximately this much distance, you can have anywhere the problem. Then that means all those areas are related to stomach circulation. So anywhere over there, if there is a problem, you will get good relief by doing that treatment, which I will show you soon. Okay, for another 10-15 minutes, I will give theory, and after that we will start practicing. So don't worry. Okay, so this is dysentery point, and the opposite side is constipation. So people, small children, see, most small children have constipation nowadays, and even adults also, paralytics, etc., Parkinson's, they all have severe constipation. For paralysis and Parkinson, constipation is, most of them have to take some churna or something. So for them, you will see that, yeah, here, this blue area, this region, approximately where it is written constipation, it is this region. This region is having this thing, having the pain or hardness, etc. Okay, and we know how to remove that. In fact, you see here, you see a number of points. Almost every point can be individually removed also. The pain can be individually removed. That is the beauty of neurotherapy, that we can individually remove the pain due to or pain from individual organs. This is at pancreas, gas, etc. Gas is not an organ, I know, but still the problem is there. Similarly, below the navel, this region, you see 1, 2, 3. 1 will always be outside, 2 is here, and then, yeah, that region below the navel. This region is where you have the problem of what ladies know as white discharge. We call it WD, white discharge. So white discharge problems, number 1, white discharge. Number 2, small children who have bedwetting problems, or even adults later on, paralysis, people may have bedwetting problems. So nowadays, the best thing is they are using diapers. But such problems, the pain will be there in that region. So if you know how to remove the pain from that region, that such problems can be easily tackled. That is the beauty. Then you see here, horizontal to the navel, you see 3 points, 1, 2, 3. That is called liver pain points. Liver is actually over here. I am not saying that the liver exists here, but the pain of liver whenever liver has a problem, it can be hepatitis, it can be anything, cirrhosis, whatever. All those pain points, all those problems, the pain will be in this region. In this region, horizontal to the navel. And this outside pain is easy to remove. Inside pain takes a long time to remove. Okay, so this is the pain of liver. 1, 2, 3. Again, this 1, 2, 3 refers to our treatment giving sequence, which we'll tell you later. Okay, we'll show you. Then here on the opposite side of liver, you have you can see what is written mucus. Mucus. Mucus refers to the mucous membranes in the body. And what is the other mucus which we all know is mucus from the nose. Or in some cases, mucus from the anus also, in case of this thing. So we say that mucus from the anus is a sign of inflammation in the body, in the large intestine. So inflammation in the large intestine invariably results in mucus in the stools. Why? You will say, why mucus comes out in the stools? Because when there is inflammation, the body always does everything to protect itself. Whether it is mucus from the nose or whether it is mucus from below, it is made by the body. It's a very, very costly protein actually for the body to make it. You know it. So it is made by the body only as a protective measure. The stools, if they are, because there is inflammation over there, but the inflammation over there means the friction will be very, very great. So the body does not want that friction to damage the large colon. So the mucus is made by the nature so that the inflammation in the large colon is kept low. So this is it. Or it doesn't harm the body. That's it. So that is why mucus from the intestine. Then you also have mucus from the nose. You may say that why mucus from the nose? Mucus from the nose is whenever the body, please listen carefully, whenever the body feels there is going to be some way infection. It can also be a hyperactive situation. When the body feels that there is going to be some infection in this region, then the body wishes to protect itself. It is like, a thief, to prevent a thief from entering your house, what do? You put some oil or you put some greasy this thing on the stair which is going to your house. So then what will happen? The thief will keep on falling down. He will never be able to get up there. So this is just an example I'm telling you. But it's really, this is the purpose of mucus over here and the purpose of mucus in the anus I have already told you about. So then whenever there is such thing, the pain will be there in these regions. The mucus pain will be there whenever there is inflammation in the intestine. And not only that, when there is inflammation in the intestine, it won't be in one place. You know, the intestine, the mucous membrane goes from the mouth till the anus. It's a continuous membrane. It has got breakages in place, but it will be there continuously at different locations. In the stomach, it is thicker, etc. So it is a continuous secretion, mucus. So only this pain in the left region does not only mean that the inflammation is only in that region. It will be there in many regions of the body. So all those things can be treated by neurotherapy. And how do you see when there is pain over here? You may find pain over here, you may find pain over here, so many places. And the moment I give it some treatment to remove this mucus pain, then automatically I see that the other areas also get benefited. So that is how we are using this. Then the pain of the ovaries, ladies' problems, or even male problems also. So the pain of the ovaries, you will see that in this region, it will be the pain of the left ovary. sorry, the right ovary. And in this region, it will be the pain of the left ovary. You can see here left ovary. We are mentioning it only one point, but it's actually, it will be there in all the points. So yeah, that's it. So left ovary and right ovary pains will be there in all these regions, but mainly in the second point, middle point. Okay. And how do you locate this middle point? From the navel, just draw an imaginary line. You just draw to your groin, the midpoint of your groin. The midpoint of the groin, if you draw a line somewhere middle of it, that is the left ovary pain point. Similarly for the right ovary pain point. So this is the way, by knowing these techniques, you can find out which area of your body, what problem is there, and then we will teach you how. We have got so many formulas which will tell you how to remove these pains. But they will all come by and by. Okay, it's quite a long course, but I have now started just to give you a glimpse of how it is to be done or what things are there. Okay, now, sir, please put the next slide, that is of the backside pain points. Elementary pain points on the backside. Yes, sir. Please share screen the next point, sir. Yes, that's it, sir. Thank you, sir. So here we see another picture. This is of the back side. And here, this is just different sites of back pain and their probable causes. That means which organs may be involved in which pains in the back. In the front, it is easy. I have told you 18 pain points are there almost. So from that, you can see that. Now in the back side, you can have this upper shoulder blade pain. We have got separate treatments for that. This is called upper shoulder blade pain, and this is lower shoulder blade pain. Okay. Different treatments are to be given for both these pains. But many of them may be linked to cervical pain also. So this may be, these areas pain may be linked to cervical pain also. In fact, we have a different treatment for left shoulder pain and a different treatment for right shoulder pain, because the different organs are involved. That is why. So then you can see this region, here it is written, pain due to spleen disorders. So this is the left side of the body. Earlier, this was on this side, when the person was facing straight, it was the right side of the body. Now you can see this is the left side of the body. And here you can see the pain due to spleen disorders. So spleen disorders means blood-related problems. Anemia, etc. They will all be related to spleen. Okay. Then here, this is another very important point. This is called right kidney or liver zero pain point. We call it liver zero because on the other side is exactly on the other side liver. And how do you locate this point? This is exactly here will be the navel on the other side. That is approximately L3 region. I am sure all of you know L3 is exactly behind the navel. So from the navel, if you can draw a line, I mean, over there, then up to here, the vertebra will be there. And after the vertebra, you will have a fleshy area. It will be really fleshy area. That is the point of right kidney pain point. The kidneys will be inside high up, but their pain point will be manifesting over here. Understand? Similarly, left kidney point, which we use in neurotherapy too much, left kidney point that is called mucus zero pain point. So that is slightly above. The left kidney is slightly above than the right kidney. So it is over here. Similarly, inflammation in the intestines, when I said mucus pain point on the other side, so we saw that mucus pain point is over here, and over there, the same way, you can have inflammation in the intestines. The pain may be manifested on the back side also. So when you treat the front side, automatically the pain on the back side will also go away. Only you should know how to treat it and what formulas to be used, which we will teach you by and by. Then lumbar region, this is a very common low back pain. Low back pain, on the other side, it will be the WD area, that is white discharge, etc. And on the right behind that, you are seeing the problem due to left ovary pain or lumbar region, uterus pain, prostate gland, urinary tract disorder. All these will manifest themselves as pain over here. And for removing this pain, all that you have to do is you have to treat the WD area with proper formulas. So WD area is in the front side, but once you treat that, you will have relief over here. Similarly, appendix and right ovary pain will be over here on the right side. Okay, appendix and right ovary pain will be here on the right side. So for that also, all that you have to do is, in fact, in appendix, it's a very common problem nowadays with small children also getting appendix. Now, the simple symptom is, it is called projectile vomiting. Veenaji, do you want to talk? I had to mute you because there was a lot of noise. The appendix pain, when it is there, it will be on the front side, of course. But whether it is really appendix or not, the inflamed appendix causes what is known as projectile vomiting. What is projectile vomiting? Projectile vomiting means normally when we vomit, our vomit will fall downstairs, just near our feet, let us say. I mean, wherever we keep the basin. Okay, the basin, it will just fall just over here. But with appendix, the vomiting will be so forceful that it will tend to fall. It's called a projectile. It will tend to fall at least, say, 2 to 3 feet away from the body, or more even, depending on the thing, on the severity. So that is one thing which appendix problem, it is definitely there. And for that also, they will immediately not go for operation. They will go for first antibiotics, and later on the doctors will ask that it should be operated. But we have seen in many such cases, by the combination of points and other naturopathy techniques, appendix can be treated well, unless it's in a very, very advanced stage. Okay, so with this, I am now stopping this. Sir, you can remove this share screen. And I think almost all these points, we'll be covering it later in our formulas, etc. Now it's almost 1 hour now. Now we will go for the practice. Okay. Now I'll teach you what you should do. Or please switch off this screen. Yeah, thank you very much. Okay. Now, up till here, I am sure nobody has any real questions because I have not started anything. But in case somebody wants to ask some question, please do let me know. Please raise your hand and I will unmute you and ask questions. Okay, you can ask questions. Manjushri, madam. Yes, madam.
Namaskar, sir.
Namaskar.
Sir, you have not mentioned about lungs. Lungs are not important.
Yeah, good idea. Lungs do not have a single pain point, and they manifest as, see, lungs problem will come only much later than after the digestive disorders start. So when we start treating the digestive disorders, then we will see what type of problem is in the lungs, and then we treat that. Yeah, lungs do not have a single pain point of the type we have mentioned here. Okay.
Okay, sir. Thank you.
Thank you. Now, Shivani ji, yes, sorry. Yeah.
Sir, you shows the point below the ribs, the gall, and I think
spleen.
I feel too much pain in 1, 2, 3 point.
Of
Just,
gall or of spleen?
both sides, sir. Here,
Ah,
and here.
uh,
Both
One
sides.
minute, 1 minute. Wait. Let me. Yeah, that's it. Tell me.
Here,
Here. Ah,
here, and here.
ah.
Both sides.
Okay.
So much
But-
pain. Too much pain.
Yeah. So that's again, this is of course special cases will have to be. We'll teach you. What I will first tell you is, first tell me whether there is any pain point over here in the front side. Do you have any pain over there? Please check yourself and let me know. Do you have any pain point in the front side? Say
Sir,
between what I called as point of gas.
Gas, sir.
Yeah.
Either.
No, on the center, between the pancreas, solar plexus,
Photo खींची थी ना?
between the solar plexus and the navel. You stand up a little bit, let me see.
So the stomach point.
Yeah, exactly. Yeah, exactly. Between
Here,
that and yeah. Anywhere over there you are having discomfort? Is it
Yes,
going in?
yes, sir.
So
Yes, sir.
today when
here is too much pain.
yes.
Here is
So exactly. So that is the root cause which we will correct. And today one of my points is going to be that only, healing the stomach region. And then once you correct that, then later on we will go for correction of the gall and spleen. Okay. Thank you very much. Okay. Anybody else? No, nobody else. Fine. So now we will, you can spotlight me. Now I'll show you what is the, sir can spotlight me. Oh, or I can spotlight myself, is it? Can I spotlight myself? Yeah, spotlight for everyone. Yeah, that's it. Okay, fine. So now we will show you to remove the pain of gas point. What are the techniques? There are 2-3 techniques involved. Then mostly we'll be doing, one is gas point and another is liver point, because these are the major players. Once these major players are set right, then they will, it is like the eldest brother in the house. Once your eldest brother, if he is all right, he will take care of the other brothers and sisters. Isn't it? So like that, the liver is the eldest brother, or I can say the mummy of the body, the mother of the body. What the liver does, it does fantastic functions. More than 1100 chemicals, more than 500 different functions, etc. So once that is set right, that is where this liver and gallbladder, your gallbladder pain, etc., they are all related to liver. The moment I set right the liver, the gallbladder will also get set right slowly, by and by. Okay. So the liver pain point, the gas only pain point, we will now see. It's very simple. The gas only pain point, I first request you, see, I am now going to give treatment from here to here. You can sit, all of you can sit in Sukhasana. Sukhasana is easiest. Otherwise, we will have to sit like this. For me, I am just showing you Sukhasana. But here, the most important thing is, for Sukhasana, this portion, the underneath of the thighs, that should be firmly pressing on the floor. Okay, because when I give treatment over here, I want a firm surface. I don't want that I press here and then here it is very wobbly. So all of you, I request, either you can keep a couple of pillows over here, firm pillows over here, or somehow you make sure that you are able to sit in Sukhasana and you are able to press in 3 locations over here, 3 or 6 locations. I will teach you. Okay. So the first point, this is called the gas point. So we will be pressing from between this groin, that is, this is the groin, the middle point of the thigh, let us say. From here till here, the kneecap, just before the kneecap. We will not go on the kneecap, we will just press before the kneecap. Okay. Before the kneecap, we will make 6 locations and we will press it. Each pressure is for 6 seconds. Neither more nor less. And how to count the 6 seconds also I will teach you. So first place your hands vertically downwards and make sure you're not putting your hand here. You're putting your hand on the thigh, on the groin, just where the thigh starts. Okay. And now I will first show you once and then you can do it later with me, because then I will like to see a couple of people. So all of you now relax. You first see what I am doing and then I can see you, and then if necessary, I can correct you also. Okay. So now relax now for the time being. So I will now start pressure. 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Now actually, if I sit very straight, then I cannot get pressure. I have just showing you. Now I should lean a bit forward. Then I am able to get good pressure. So all of you, when you do it, you will remember that you have to lean forward and you have to make sure that this area is flat on the bed or on the sofa. I mean, don't use the sofa. It should be a hard bed. Okay, now this was first location. Then second location. See, from here, I go just a few inches below. This is the second location. Then I will lean forward a little bit. 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Then I come to the middle of the thigh, both thighs, middle point. 3, 1, lean forward. 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Then fourth point is slightly ahead. 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Then just a few millimeters, just move. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. And the last one, just see, this is the kneecap, just below the kneecap. Here is a fleshy point. So I press downwards. 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. So this was one round. Normally, with one round, your newcomers may not get a lot of benefit. So now we will all, those who have been doing with me, doesn't matter, now you will all be starting to do. And I will be seeing this thing. And then, now somebody, wait a minute, madam, yeah, who is this? Akshaya, madam. Yeah, that's right. Kanta Bagaria, madam, I can see. Oh, I will see, I will get the gallery view, then I can see everybody. Yeah. Oh, I have got about
So
5,
how
6
much
people.
pressure we have to apply?
Good question. Very good question. The pressure need not be too much. It should be just, because you see, we are just going to press on the blood vessel. You know, blood vessel is below. So just approximately, I cannot say in kilograms, but the pressure which you apply like this, you see, when you apply like this, whatever pressure you are able to apply, that much pressure only we require. We don't require too much pressure. Okay. Now,
Sir, I'm getting a
The
lot of
pressure
belching
will
once
be
I'm
from
doing
the
it.
palm of the hand or from the finger, sir?
yeah. Good question. So we use this base of the palm, not here. We use the base of the palm, just this portion. I mean, from here till here, up to here. This all the area. We are not using this area. We are not using the front of the palms. We are using only the base of the palms to press. And of course, a little bit overlapping can be with this area, because that will give a good soft feeling. So, but basically the pressure is with the base of the palm. Okay. So now,
getting
how
a lot of
much?
belching. I'm doing this now. I'm getting a lot of belching.
Yeah, I know. In fact, that is what I say. This is releasing the belching. The gas will be released, and you will feel a lot of relief over here. When those of you who are now on my screen, this thing, I'll just name Shankar ji, Shankar Ram ji, Saraswati ji, Ravindra ji, etc. Now, all of you, you can see that you will have a lot of belching. Don't worry about it. That is in fact needed. That belching means
We should do this just anytime in the day, before lunch, after lunch. There are any restrictions?
no, it should be done only before lunch. It should be done every day, in the this thing, before lunch, breakfast, lunch, and dinner. Whatever you eat, solid food you eat, before that, it is better to to give this circulation. What does it do? It gives circulation to the abdomen. So wait a minute. It gives
How many
circulation to
times?
the. Pardon me?
How many times, sir, karna hai? How
No.
many times?
Till you feel comfortable over there. It may be once or twice at the most. Some people may require 3 times. But we say, since you are doing 3 times a day, it is better not to overdo. Keep it 3 times a day, once before breakfast, 1 round, once before lunch, and once before dinner. And within 2-3 days, you will see that it is you
So
have got
which
good.
point of the thighs in the vertical lines, the thighs, center of the thighs, it should be?
So can you show again, please?
Yeah, I'm going to show.
The vertical line should fall in the center of the thighs or at left side or right side?
Good question. Wait. I will now show you what really is needed. Okay. I will now spotlight myself.
Why?
So that you get the speaker. Okay, fine. This is it. So now, see, you have to, with your base of your palm, you keep your hand approximately in the center, and then later on you have to slightly press inwards. You should not press outwards, because outwards, if you press, you will have pain later on. So you have to press inwards because the muscle is going inwards. So you will keep this thing approximately in the center, and then you will press inwards like this. See now I can see. Can you show me? Can you see me? Now I am pressing inwards. This is how the vertical pressure has to be applied, and you have to lean forward, of course. So we'll again do this exercise. This is a very simple exercise. This is called gas only 6 points. Okay, gas only 6 points is how is it given. So keep your hand, once again I repeat, you keep your base of your hand over here like this, and keep it in the approximately in the middle of the thigh, and the other hand also middle of the thigh. And then pull the muscle inwards, slightly inwards. Lean forward, and then say 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then come back, relax yourself, then go to the next point, just a few millimeter or a few centimeter downwards. Because you see, you have got to mentally divide this into 6 regions, this area, 6 regions. So here, the first point is here, and here is the middle point. So in between that, you have 1 more point. So the first point here, second is slightly below. Then again lean forward. Then 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Again, come back, relax, and then go to the middle of the thigh. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. Then that is middle. Now, between here and the kneecap, again I have to make 3 points. So 1 here, the next point, 4th point will be just slightly ahead. So 4, 1, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Then the next point is slightly ahead. 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. And the last point is just at the kneecap. Okay. Now I will just move my legs a little bit so that you can see properly the kneecap. And okay, last point is just before kneecap. And here, instead of pressing like this, I find it is easier if I with my base of the palm, I press right vertically downwards. So this is also possible, but slightly you have to pull inwards. And here there is a fleshy region over here. You can see there is a fleshy region. So that is the region which I will be pressing. There is absolutely no point in pressing on the bone because it won't help us. It's not harmful, but it won't help us. So you have to press inwards. So 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. So from here to here, for the time being, 1 round is enough if you do it once a day, 3 times a day or 4 times a day. And you can, of course, use it later. You can use this technique whenever you feel slightly, gaseousness, you feel I am not able to, I have eaten food, but I don't feel very comfortable. And immediately I start belching or I give stomach gas, etc. So for both those things, this is the starting point. And
So
you will
this is
invariably find.
so this is removing gas from the bottom part, or is it releasing gas from the whole body?
No, it is, yeah, good question. It will remove, it is not really removing gas. It is increasing the stomach circulation. And by increasing the stomach circulation, the formation of gas is, let us say, eliminated first. Okay. Then this is for the upper gas. Now, for people who have a lot of flatus means gas from below. For them, another different point that also I will teach you now. So that is, see, upper one was here. Now here, this is the calf muscles. This is on the calf muscles. And
So
and
instead of pressing, can't we do little slight massage from point 1 to 0.6? Is it possible?
See,
Will it help?
It is possible, but it does not always give the same type of results. I am not saying that it is impossible, but you see, because you see, massage people are massaging the legs, they are massaging the thighs. This is a very well-known technique of massage, but it doesn't always give that result which Dr. Mehra has found out with his experience. That 6 seconds pressure, and it should be in these regions. And the pressure, see, it's a good question. Let me repeat. What are we really doing when we are pressing downwards? When we are pressing downwards, what we are really doing is whatever blood was to go below that point, that is let us say the groins. Below the groins, whatever blood is going, I am temporarily holding it. And when I am temporarily holding it, since this whole thing is like a, if you see the circulatory system, you will know that it comes from the aorta. The aorta comes like that, and it comes in a bend that is called the abdominal aorta. From the abdominal aorta, it goes to the kidneys, and from the kidneys, it comes down, and then later on at the femoral artery, it bifurcates. So when I am pressing on the femoral artery on both these locations, what I am really doing, I am not allowing the blood to flow over there. So where it will go wherever, whatever other point, by God's grace, Dr. Mehra, Guruji has discovered that it is over there. It is a meeting point over here. So as we go to the first point of the femoral artery, that is the first point over here. Good question, very good question. I didn't know you will be so much interested. I'm very happy to talk. So when I'm pressing over here, this meeting point will be approximately in the just below the sternum, let us say. When I'm pressing over there, the blood flow over here, this region increases. It has been found. Why I am saying it is there? Because that pain over there reduces considerably after 2 to 3 days. So then when I am pressing over there, it goes over here. When I am pressing below, it goes slightly down, slightly down, slightly down. Like that, it is clearing the blockages, etc. It is improving the blood circulation in this region. This is how it is working.
Okay,
so
thank you.
whatever you are doing, it is only to improve the blood circulation at a different location. I am not treating the thigh. I am by pressing and by pressing at the thigh and by preventing the blood from going down below, I am helping it to come upwards. And it has been found by let us say, divine providence only. The 6 seconds pressure it has been found to be very beneficial. Of course, later on, we have got other different types of 12-second pressure, etc. That all came much later. But this was the fundamental.
Sir,
one more question. So when we use Navi pump, it also then pulls, like it's also supposed to use it not just to centralize the Navi, but also for gas and constipation. So if anybody who has gas, they use Navi pump, and then that Navi pump also probably does the same function of increasing the circulation. So which technique would be better? Because for us as therapists, we are always told that set the Nabi first and then make any treatment. So when we are setting the Nabi, we use any which way is the Nabi pump. So if we're using that and this technique is there, between these two, what is something that we should use? And what is the difference, or how does it impact differently? How does a Nabi pump impact, and versus how does this technique work?
No, let me tell you one thing. I do not know about the Nabi pump in that sense. I have heard about it, but I have not used it. And I'm just joking. A person who has something to sell or something to give will only talk about his point. I do not know about the other thing. But what I suggest is, if you have got good results with the Nabi pump, and you use this technique for one day, but don't mix both together. Don't mix both together. You use this technique for a couple of days, or in fact, I am telling 1 week now, because by God's grace, I'll be meeting you next week. Then you use this technique, and then you decide, because you see, every patient is different. No two patients are alike. Even the same patient on different days is different, isn't it? So this, who will benefit by what treatment best? That only the patient or you have to only decide by doing it. If using an Nabi pump is very comfortable, absolutely no problem. The point is that I am teaching you that there is a pain point between the solar plexus and the navel. Your point is to clear that pain point, whatever way you use. I have no objection.
So one benefit for this is, here we are not using any tools, but we are using our own self and body to cure ourselves. So Navi pump will be requiring a tool. So this is a very
well
good.
said, thank you.
Yeah. And here we can also use this technique for diagnosis.
Yeah, that's it.
So this,
we can.
Yes, sir.
Acha, now Ravindra ji, you had a question.
Yes, sir. Some people like us, we cannot sit in Sukhasana. Like what you told, you have to sit that position, you have to give pressure. Then for us, what to do? Whether any other any other
wonderful,
point is there,
wonderful.
Or we can stretch our leg and do it like that.
Wait a minute. You can do it very easily by sitting on a chair.
Yes.
By sitting on a chair, but only the chair should be hard. It should not be soft. But the cushion should give you enough pressure. So you can do this very well, very nicely. You can do it by sitting on a chair.
Actually, first point, what you told, 6, that point you can do with the sitting chair itself.
Yeah.
Second point you are going to teach, other below knee. There you have to sit only. That means you have to stretch your leg and do it.
Yes. Yeah, you can stretch your leg and do it if that is, if you can see, it depends on whether you are able to apply pressure in that position. See, the point is, I am not touching the bone, I am touching the calf muscle. I'm pressing on the calf muscle. The calf muscle is a soft area. So when I'm pressing the calf muscle, naturally, I must have a firm support. If you can ensure that, then you can do that by that way.
Sitting in chair, first portion we are able to do. The second below knee, you are going to teach us, There either you have to bend too much and do it.
So that is what, otherwise we will have to think of nowadays. In fact, it's a good thing, because I always try to innovate from people's this thing. 1 minute. I'll just spotlight myself. Okay. So I always try to see that how the other person can benefit by modification. So what I found, suppose you are able to, if you are going to follow this rigorously, if you are able to make a Velcro type, like your that blood pressure cuff.
Yes.
Like the blood pressure cuff. Suppose you are able to make a Velcro type arrangement. It just comes in. This any small darji, the tailor will help you. So if you are able to do that, or you can do it at home. It's
So
only
that portion alone, you tie it and do it some 6
yes,
seconds.
yes, exactly, exactly. Because more than that, more than the lower gas, the upper gas is a greater problem to many people. Lower gas is problem only after the upper gas is not tackled. Once I tackle the upper gas, the gas only the between the groin and the thigh. Once that is tackled, lower gas problems they much reduced. And in the meanwhile, of course, as you come to our other classes, paid classes, etc., you will learn a lot of these things. Okay, so now
can someone else do it for someone else?
Yeah, that's what I told you. No, originally it was a one-to-one treatment. Originally, neurotherapy started as a one-to-one treatment, but with COVID, people having to stay away from each other. With that only I evolved this technique. But otherwise, it can be done by one-to-one. Anybody, you just lie down flat on the floor and then ask somebody to press for 6 seconds on your thighs. Put a nice pillow under the thigh and you do it. Yes, why not? Of course, it is possible. I mean, for the next one, even for this one or the next one, both a person can be lying on the floor and they can put a pillow under the thigh, and then somebody else can give pressure from the.
So can we use this technique like a lot of people have pinched nerves on the cervical or the T6, T7 area, and they have a lot of gas entrapped on their scapular region. So the moment you press the scapula, they will have a lot of burping or pain and all of that. So can we use this for that as well?
Yeah. This clears. The root is the stomach gas. The root is the pain point between the solar plexus and the navel. You first clear that. And this is not we have got about 170 formulas, different formulations. Almost about 100, more than 100 plus points are there, which have to be mixed up in various permutation combinations, which we will be teaching you by and by. So definitely all those, this can be used for that, but first you have to check the pain in the gas pain point. Check that, relieve it first. Don't think that this will immediately work on the scapula, but it will by and by, because you see the build of gas, when the source, when the stomach is not producing gas, then that gas will be released in elsewhere and it will again come back to the stomach only. So then once that is done, again you release it. That is why I said if you do this treatment thrice a day, from morning, afternoon, whenever you have a meal, and whenever you eat a solid, any solid, it can be rusk, it can be bread, it can be anything, ragi mudde, whatever you have. So then you will see that the results are coming. Next week, I will be meeting, many of you are going to tell me, sir, I have got a lot of benefit. Last time when I had this class 3-4 years ago in Joshi group, at that time, 3 years ago, in fact. So at that time also, many people wrote to me the next week. They put this thing in, I think in the group also, that they were benefited. Okay. So anybody else having any question? Now we will go for the next point, that is the gas. That the next gas, intestinal gas. For that is called, we call it gas eye. Gas eye means gas of the intestines. Okay. So now I will show you. See, here is sorry. Monitor একটু দূরে নিয়ে নাও না, আস্তে করে একটু মনিটরটা একটু দূরে নিয়ে নাও, আস্তে করে। হলো, মোটামুটি হলো। Yes, হয়েছে। Okay.
Sir, little more. Can't see the knees. Please.
You don't require the knees now. You require below the knee. See, this is the kneecap, which is, I will show you. This is the kneecap. We are not going there. We have to go down over here. This is the first point. Are you able to see it now?
Yes, sir.
Yeah. So this is the first point of the thigh, of the calf muscle, between here and just before the ankle. Just before the ankle, we are going to mentally locate 6 locations. Or sometimes people cannot, short legs, the calf, the length is short. You may not get 6 locations, get 5 locations or 4 locations, it doesn't matter. But only this is the area for the intestinal gas. So Now, again, as usual, I am using the pressure with this area, okay, and not using this area, not using the fingers. So, and I am pressing inwards. I am pulling the muscle inward. So, and I am applying vertical pressure. So, as usual, I will have to lean a little bit forward. Okay. So now all of you can, those of you who need a support, please keep a pillow over here, firm pillow over here. If you cannot lie fully flat over here, then please keep a firm pillow. And then again, vertical pressure. I will start 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then immediately a little bit down below, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Then middle of the calf muscle, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. You see, I am using only this portion, remember, and I am pressing downwards like this. Okay, next, fourth point, 4, 1, lean forward, 4, 2, 4, 3, 4, 4, 4, 5, 4, 6. Now, this point is quite painful for some people. It doesn't matter. After a few days, you will see that the pain goes away. Then 5, 1, 5, 2, 5, 3, 5, 4, 5, 5, 5, 6. The last point is just, this very little area over there, just a small area. So just, this is the shin bone or ankle bone, just below the ankle bone. Below the ankle bone on both sides. Here also, the ankle bone is over here. So, sorry, over here. So just below the ankle bone, there is a small fleshy area. So I am pressing downwards. So like this. Of course, I'll have to keep my fingers crossed because 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. So 1 round over here and 1 round over here. This normally is enough for both types of gas from the stomach and gas from the intestines. So now we have covered one point. That is called gas only and gas eye. And what it does, it stops the blood flow from going below that point, whatever point it is there. And since you can understand that below the kneecap, the area is very less. So that is why that small 1/3 area has to be covered in this 6 points or 5 points. Okay. Whereas the upper area is bigger because the femoral artery there, the artery is pretty big. So a lot of blood is going to be stopped by when I am applying the pressure. So more blood will be available for my gas point. But whereas when I go below the kneecap, this thing is very small, the area being very small. So that is why a small area of this much only, and that has to be covered in 6 points. So that is why there it is taking, and that is why it is very difficult to treat this. Incidentally, there was some recent research which said that if in any way you use your calf muscles, you can use it by many ways. By just lifting the toes also up and down, you can strengthen the calf muscle. Any way you do, apply exercise for the calf muscles, it will benefit in diabetes. This is a recent thing. Of course, there is a very simple exercise for it also. When I saw a video elsewhere in some other group. So it's a very simple exercise. So, but what I am saying is that this is so effective that it can benefit diabetics also. And if you do this regularly and you get rid of your gas problem, automatically blood pressure, diabetes, everything goes down. Everything becomes better. But of course, I am not saying that this is the only formula. As I said, we have got lots of formulas for lots of different types of constitutions. But this is a very, very useful formula. Okay. So now that was gas only and gas eye. Now we will go to liver point. Liver point is very easy, but it is very beneficial. In fact, we have cases where some of our therapists, one of our therapists, very important therapist in Bombay, her daughter had malaria, had this thing, malaria. And then that was just before pregnancy or something like that. And they were worried because they cannot give malaria, taking chloroquine and all that. It is dangerous for the baby. She was pregnant already. So that time we gave this treatment, 1 point liver. And believe me or not, within 3 days, the malarial parasite came down. How the malarial parasite? We did not give any medicine to kill it. All that we did was strengthen the liver. The liver got strong. Automatically, it took care of the parasite. And this we have seen after that, so many cases. Anybody, suppose in childhood, somebody has had typhoid or malaria or jaundice. These are the three things in which bilirubin level goes up. In any of these cases, you start giving this treatment, which I am going to teach you now, and like that, you will see results. And you will see the result in the report. The case I am talking of is the report said, the doctor was flabbergasted. He said, what medicine? Have you brought some medicine from abroad or something? How did, within 3 days, how did the malarial parasite come down? And we told him that we have got a treatment like this. They did not believe that. They did not believe that. They thought we are just pulling their legs. But we know.
So we can use this point even for low bun count, bun B1.
B1. Low bun, the root cause may be elsewhere, but definitely it will help. Liver, no, then you should make a combination. Both this CNNS gas, this gas one and liver, both you give together, slowly it will start coming. But then for bun and all, you will require many more strengthening. You will require to strengthen the kidney, you will require to the liver, everything you will have to give. Then you have to take care of the cholesterol. So many things are needed to take care of serious problems like that. But this is the starting point. You can definitely use this as a starting point. Yeah. So now let us see how. Yeah, pardon.
Sir, for fatty liver also, this point will work, sir.
Wonderful. This is really the best treatment for fatty liver. And for fatty liver, I will teach you another small technique, an additional. It is in naturopathy or Ayurveda, let us say. I will tell you that for fatty liver, both those things, if they are done within 15-20 days, you will see your liver profile becomes better and better.
Okay.
Fatty liver is very good, no doubt. Wonderful.
Sir, with this liver point, we can cover this HGPT and HGOT also?
Yeah. Of course.
Okay, sir.
Nilimaji, thank you.
Sir, for hernia?
No. Hernia is a different issue altogether. Hernia, are you talking of umbilical hernia or inguinal hernia or what?
Inguinal and hiatus, both. Inguinal.
No. For that, you have totally different procedures, protocols. We will not be dealing with that. But liver, you see, liver can always help to strengthen the body. You can always give the liver, but it is not a total cure. It may not be a total cure immediately. Okay.
Sir, first you teach the point, then we'll ask the question.
Yeah. I thought but anyway, because people are anxious to learn, so I answer their questions. Otherwise, now we are going to.
Person do this?
Pardon?
Can a high BP person do this?
Yeah. Both these two treatments are very good for high BP also, as well as for low BP. But high BP persons for gas and liver, this will be very good. Okay, now I will teach the point and then we will talk later. Okay, now here in liver, we are going to use only the left hand. This is my left hand. And we are going to use the left thigh. And again, as we divided for the gas, we have to mentally divide this region into 6 portions. And we have to divide the hand in 6 portions. Now, earlier, when it was a 1-to-1 therapy, the person will lie flat on the ground and there will be a pillow below this and there will be a pillow below the thigh and some other therapist will treat. Because here you require to treat simultaneously 2 points, two locations rather. So one location is on the hand and the other location is on the thigh. So how can you do it? No, I cannot do like this and do like this. It is most awkward. So what I have decided, what I have found out, very simple, is you use this portion of the bone. That means my hand is going to press vertically down here like this. And this portion of the bone, that will press on my thigh. So it's very easy now to understand. So I will just show you first. You see the demo, then we will all do together. Okay. Now, this is the first location is over here, like this. See, where should you start? This is the elbow. Just below the elbow, we are starting. We are not going above the elbow. That is a different point altogether. So this is below the elbow. We are starting, and we are placing one hand vertically downwards. And again, I am using the cup of the palm and more of the lower region. And I am definitely not using my fingers. I'm using the cup of the palm and the lower region. So like that. And here again, you have to pull downwards, inwards. So one point is over here. Then this point, it goes just the first point of gas, that is the groin, near the groin. And I place it at, at almost 90 degrees. I can place it like this also, but I find it comfortable to place like this. Okay, so now I am giving pressure like this. I am giving pressure, vertical pressure, 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then what have we done? We have now stimulated a portion of the liver. We have applied, we have allowed the blood flow to a portion of the liver. Okay. And that is really somewhere over here, let us say. The pain point will be over here. So when we are stimulated, when we are giving a job to a person, at home also, when you give a job to a helper, then you expect that the helper should do the job. The helper will expect that I should be given some time. So similarly, because we are pressing for 6 seconds, we are increasing the blood flow in the liver region. This is by experience we have found out that the pain goes away. So then we wait for approximately 1 minute. About 50 seconds to 1 minute we wait. And sometimes when we are very in a great hurry, we will wait for at least 30 seconds. So 1 minute is very good, 1 to 1.5 minutes. So we wait for a minute, then we will go to the next point. Okay. So now the next point, how do you give? The next point, how do you give? Again, this is the first point. This is the second point. Okay. The third point will be the midpoint. So this will be before the midpoint. And here in the thigh, again, the second portion of glass, this is the midpoint of the gas, and this is the second portion. So I will again keep my hand slightly at 90 degrees. And then this is the second one, 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. What I have done, I have pulled inwards here and I have pulled inwards here. So both these inward direction is very, very essential. And again, I'm waiting for 1 minute. Today, I may not wait so long, but I will tell you, normally we wait for a minute. And after 1 minute, we are now going to the midpoint of the thigh. The midpoint of the thigh. The midpoint of the thigh is here. And here, the midpoint of the hand. So again, I place my hand at 90 degrees. And I am making sure that this portion is pressing properly on my thigh. So I am pulling inwards like this. Now you will see now how I am pulling inwards. See, I am pulling inwards like that. Okay. And then I am applying vertical pressure. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. So this was 3 locations. Again, next one we will go is the 4th location. Just about 1 minute later, we'll do that. So let us do. So what again where I will do, this is the midpoint of the arm, and this is the end of the arm. So approximately over here, I will now apply. That is away from the midpoint, but definitely not middle, because here we require 2 more points. So we require 1 point here and 1 point here and last point here. So like that, we are giving 3 points. So now we go to the 4th point, and again I am pulling downwards, and I am pressing inwards and downwards on the hand also. 4, 1, 4-2, 4-3, 4-4, 4-5, 4-6. So this was 4 points. Again, we are waiting for a minute. And this time we are now, we have finished. Halfway is 3rd point, then 4th point. Now 5th point is over here, and the last point is over here. So the 5th point over here and last point over here. Okay, last point is just below the wrist bone. So now I am going to the 5th point, and again here also 5th point. Again, I am pulling inwards like that, and then I am pulling inwards, and then again here also I am pressing downwards. 5-1, 5-2, 5-3, 5-4, 5-5, 5-6. So that was 5 points now. The last point now, the wrist, I will just show you. See, this is the wrist. This is the wrist bone. Just below the wrist bone, you see, this bone is so thick here. So here, wherever there is, I can apply pressure, that is this portion, not over here. So the last portion will be over here. Okay, and then again, I will apply pressure like that. And then here, as you saw, the last is just before the thigh bone, before the kneecap rather. So before the kneecap, I keep, and then I keep this, and again I keep at. So before the kneecap and before the thigh, this thing, okay, 6-1, 6-2, 6-3, 6-4, 6-5, 6-6. So this was 1 point lever into 6 treatments. And now I am sure I saw many of you are practicing, but if anybody wants to show me how they are doing, then we can spotlight them and we can see. If you have any doubt, I think it is pretty easy. Now, if you have any doubt and you want me to see the way you are giving any point, you can let me know, because we still have about 15 minutes left. So, Saraswati ji, tell me.
Yes, sir. Sir, the pressure on the thigh I got, like how it should be down based. But for the hand, where it should be like this, towards the thumb side, middle, or how
No, it should be towards the inner side. See, wait. So, it should be like this, not like this.
Okay.
The pressure on the hand should always be in this direction.
Okay.
And even the thighs also, it will be in the inner
Yes,
direction.
sir.
That means towards the groin, this thing, inner side of this thing.
Okay, sir. Thank you.
Thank you.
Sir, in the
What is the logic of
One minute. If all of you talk, it will be difficult. Tell me who is, please raise your hand and I will, then you can talk. Everybody can talk, but one by one. Who wants to talk?
Radha.
Radha Rani ji. Radha Ram ji. Sorry. Radha Ram ji.
Sir, do we need to do for both the legs in the same way?
Yeah. It is both legs together. Oh, you did not see. Please wait. See.
So you said treat only left side for liver?
No. For liver it is. I thought you were talking of gas. For liver, it is only the left side. Because I'll tell you one thing. Why the left side? Because the main liver is on the right side of the body. And in our neurotherapy, you will see that later on, that right side of the body, the organ is there, I will press on the left side. Why? Because when I press on the left side, the blood flow will go to the other side. Understand? Actually, what we are doing, we are only pushing the blood to a particular...
For stomach, sir, we should be doing it only on the right side, is it?
No. For stomach, it should be both thighs. For stomach, it will be both thighs.
For stomach and intestine, both the sides we have.
Both the thighs, yes. Stomach means both thighs, intestine means calf muscles.
Okay. The middle portion only we are concentrating, right, sir? While pressing, middle portion of the thigh and middle portion of the calf muscle.
No. For stomach, we are going right from the groin up to the kneecap. That is for stomach. And for liver, also right from one end of the groin up to the kneecap. And in the hand, from the elbow to the wrist. And for gas, gas in the intestines, we are going from the kneecap up to the ankle on both legs.
Okay. The 6 equal portions we are dividing.
Yeah. 6 equal portions we are dividing. Correct. The reason I have told you.
The
Sir, the
pressure we are
pressure should
giving
be
exactly on the middle, right, sir?
Pardon?
The pressure we are giving exactly on the middle of the
Yeah.
thigh.
From the middle, we are pulling downwards. From the middle, we are pulling inwards.
Down. Okay.
Yeah. Thank
sir,
you.
towards the little finger, sir. Pull is towards the little finger, right, sir?
Yeah. Towards the little finger. Right. Yeah.
So is there a particular time to do this? Should we do it empty stomach or morning
Very
or
good
night?
question.
Is there?
Very good question. This is normally done once before breakfast, once before lunch, and once before dinner. If anybody is having liver problems like fatty liver, etc., it can be done another 3 more times, but definitely not on a full stomach. Some more empty stomach. Let us say in the 4 o'clock you are going to have your tea. Before that you can do it. Or night just before dinner you can do it, etc. So it should be preferably on empty stomach. Preferably, as far as possible. Yeah.
Thank you.
Welcome. Yeah. Next, Punita madam. Please let me know.
Yes, sir, that's what I wanted to ask. Towards the little finger, the pressure is there in the calf muscles. And all the pressures is towards inside, means towards the little finger, right, sir?
Calf muscle, little finger. I didn't get you. Please show me what you want to say.
Inside, sir. It is inside, sir.
Yeah, please show me.
Sir, towards like this, sir, it is.
No. That is outside. That is outside. Inside. Please show me.
So inside?
No. On the other hand, see, I will tell you. On one hand, no. Oh, you are right. This is. Yeah. You are right. It is. You will call it towards the little finger. Yes. I'm sorry. It is little finger towards the little finger. Right.
Okay.
That is because little finger is only inside. I was talking inside. It is little finger. Correct. You are right. Yeah. Perfect.
Sir, in the calf also it is towards inside only, sir.
Yeah. Towards inside. Calf is definitely towards inside.
Everything is towards inside only, sir.
Yeah. Because the outside in the calf muscle, outside is in the bone. The bone. You cannot touch it. No.
Yeah.
So it's always inside.
The
Asha,
fatty part, sir. The fatty part.
Yeah. Fleshy part.
Fleshy part. Yeah.
Namaste,
Asha,
sir.
Yeah, Asha madam, tell me.
Very, very nice class. But sorry, I got the message late. I mean, I didn't see the message and it was late. So can I get a recording? Like I saw from 9:30. I'm sorry, I was busy with the thing. So can I get the recording?
You won't require it because you see, these are all going to be repeated several times. And, later on, we are going to have paid classes. There you will have detailed recordings. Everything will be there. Right now, you won't require it because I will be doing some revision next class also. So that time, you will definitely get whatever you have missed out, you will get it there.
Okay, and sir. For today, you taught only about the liver class, or did you teach any else also, sir?
I taught something called gas, the pain in the gas point and pain in the liver. Both of these I taught. And they have started, I think we started at 9:10 or so.
Okay, sir.
Okay. Thank you.
Gas means
I'm on unmute.
From our body,
I'm unmuted.
Wait a minute. There are 3 people now. Punita
sir,
madam.
Gas means, what do you mean by gas? The wind which is coming out from the body?
Yeah. The wind which is coming out from the body either as belching or as flatus.
Okay. Got it,
now,
sir.
Please, thank you very much. Punita madam, please tell me what you want to ask. Punita madam.
Sir?
Yeah.
Is that me? Sir, can you just show me of your hand? Sir, is this correct?
Yeah, wait.
This is
left
leg.
Yeah. Yeah, exactly.
Okay, and left hand,
Yeah.
which you're saying, and the hand, this will pull inside, that's correct. And this will pull outside or inside towards the little finger?
Inside, towards your body.
So then it will, how will your hand placement so be?
Yeah. 1 minute.
So please.
Yeah, sure. 1 minute. Spotlight for everyone. Okay. Now, for liver. Now, I will just show you first.
Hand. Left hand. Yes.
Left hand. Yeah, left hand only.
Yes.
Left hand only, and I will make it very comfortable. Like this, you can now see very nicely. Okay.
Yes.
So now I will just show you like this. Over here. See, here I am pressing, I am using the base of my palm. I am using only this area. Okay. And then I am pulling it inwards, towards. See, like this, I am pulling it inwards. I am just giving you one by one.
Okay.
Yeah, I am pulling it inwards like this.
Okay, sir.
Like this. Okay. And similarly here on the thigh, I am pressing this bone. I am pressing it and then pushing it inwards. See?
Inward.
Yeah.
Okay, sir. That's fine. Yeah.
Right.
And this is inward also.
Yeah.
Okay.
Yeah. Both of them are inward. Yes.
Okay,
Thank
fine,
you.
sir. Thank you.
Welcome.
Sir, in all the points in the thigh, sir, 1 to 6, sir, we have to use this elbow bone to pull it inside, right?
Yeah. For liver, you use the elbow bone. Otherwise, you can ask somebody else to give the treatment also. Definitely.
Okay.
Either,
Thank you.
Yeah. Now, Malati Jain, madam, please unmute. Malati Jain, madam, you had a question. Now you removed.
Yes, sir. Sorry. I was on mute, sir. Sir, does this help frozen shoulder also?
For frozen shoulder, there are different treatments, but this will help a little bit. Definitely, because you see, frozen shoulder also comes due to gas buildup. So when there is a lot of gas buildup, if you remove the gas, that is the source. I am tackling the source, the root cause. And so naturally, frozen shoulder will eventually get cured. But for frozen shoulder, we have different treatments, and they are also very essential, very effective, which probably after 3-4 sessions we will teach you. Okay. Yeah. Now, who else? Yasmin ji, please go ahead.
Namaste, sir. The class is very nice, and I like your teaching, and the knowledge is also very good. I just wanted to ask that the liver point that you have said that can be used for fatty liver, will that help for GB stone also?
Gallbladder stone? Yes, it will help definitely, because this liver is this thing. But for gallbladder, we have got another. We will later on teach you a point called gall. So 1 point gall, 1 point liver, we call it. That will help you even further.
Okay.
And
So
another thing is if you are having pain in the gallbladder point, then we will teach you a simple technique to first release the pain. Then you can do many other treatments. But liver treatment you can start today itself. For gallbladder pain, you can definitely start liver treatment today itself. Yeah. Okay. Yeah. Thank you, Ranjani madam. You can lower your hand and talk.
Sir, can we do this both the gas points and the liver points immediately after 1 by 1, or how should we give any gap between those?
It will be nice if you give at least a 3 to 5 minutes gap.
Okay, sir. Okay, thank you, sir.
But in case you don't have time that much, then it's okay. Give 1 minute gap and do it.
Okay, sir. Thank you.
But some small amount of gap is needed, because as I told you, we are giving a job to a servant. So the servant should be given time to work on that job. Meenu ji. Yes, madam.
Sir, any treatment for tuberculosis, sir?
Very advanced this thing. So many treatments we have to be given, and it is a full system disorder. So you have to keep on, but you can start the liver point. Don't do the gas right now, because you have to find out where the TB has spread. Where has it spread?
Sir.
Is it bone TB or is it lung TB?
Lung TB, sir.
then you just start with the liver and go on giving liver every day. Don't worry. You will see within 3-4 days itself, you will see that the aggravation. And do you have stomach gas or anything like that?
No, sir.
That's why. When lung problems, they don't have all these problems. They have different types of problems. You have breathing problem and this and that.
Actually,
and I
sir,
should know.
my son has suffered this problem. Then I question.
Yeah. No. We will help you later. See, let us go through a few more classes. Then we will go through later. And then right now it is now going to be 10 o'clock. So Joshi sir may like to close the class.
Yeah,
Sir,
we want to close this session. Actually, it crosses the time.
Yeah.
Anyway, we will be grateful to your
Sir,
time
can
and
you
your
just show
experience.
once more the point for gas?
No, next week we'll cover it next week. No, again I am going to show you the whole thing.
Sir.
We are going to have a revision. Please join in time. That's all.
Okay, sir. Next time I'll join.
Yeah, please.
Again, we will have the session on the next Friday, same time.
Yes,
And he will continue the session. You will get more
Thank you very much,
details
ma'am.
about the
Thank you, sir.
neurotherapy.
Thanks a lot, sir.
Thank
you, sir.
And thank you so
Thank
much.
you, sir. Very nice class. Thank you.
Thank you, sir. I just have a small ending
you, sir.
prayer.
Thanks a lot, sir. Thank you, sir.
Please listen to this prayer.
Please.
May God bless you all and bless each and every cell of your bodies with health, happiness, harmony, peace,
Thank you very much,
prosperity, and success. Yes.
Thank you, sir.
That's all.
Thank you very
God
much.
bless you. Okay. Fine.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you.
Thank you very much.
Thank you.
Thank you,
nice.
sir.
Thank you.